Today in this PPT we are going to discuss case presentation on alcoholic hepatitis. What do you mean by alcoholic hepatitis? Before understanding about alcoholic hepatitis, we need to understand a condition called alcoholic liver diseases. What do you mean by this alcoholic liver diseases? What causes this alcoholic liver diseases? When excessive alcohol consumption causes this alcoholic liver diseases. It occurs through three stages called alcoholic fatty liver, alcoholic hepatitis and alcoholic cirrhosis. Alcoholic hepatitis we are going to discuss in this PPT. All heavy drinkers develop alcoholic fatty liver as a first stage of liver disease, and this stage can be reversed when the person stops drinking alcohol in this stage. 10 to 35% of heavy drinkers develop into alcoholic hepatitis from this alcoholic fatty liver stage. What do you mean by alcoholic hepatitis? Hepatitis means inflammation of the hepatocytes. Inflammatory condition of the liver is known as alcoholic hepatitis. This is caused by heavy consumption of alcohol over an extended period of time. Ongoing alcohol use, still we are consuming alcohol and the person is doing binge drinking, can aggravate this condition. Coming to etiology of alcoholic hepatitis. Alcoholic liver diseases are caused by mainly due to heavy consumption of alcohol. People with binge drinking can firstly develop into alcoholic fatty liver as a first stage of alcoholic liver diseases. What do you mean by this binge drinking? Binge drinking is nothing but drinking too much of alcohol in a short period of time. Alcoholic hepatitis and alcoholic cirrhosis are linked to the long-term alcohol abuse in alcoholics. Coming to the risk factors of alcoholic liver disease: obesity, being overweight, female gender. Generally, females are more prone for the alcoholic liver disease because they lack the enzyme called alcohol dehydrogenase, which metabolize the consumed alcohol into acetaldehyde. Because of lack of this enzyme, if a male and female consumes equal amount of alcohol, females are more prone for getting alcoholic liver diseases. And one more risk factor for getting alcoholic liver disease is hepatitis C infection, and of course genetics, pattern of drinking, quantity of alcohol intake, malnutrition. Particularly vitamin A and E can worsen alcohol induced liver damage. Coming to signs and symptoms of this alcoholic hepatitis. First and the foremost important sign is yellowing of the skin and whites of the eye. This condition is usually referred to as jaundice. Coming to other signs and symptoms, generally include loss of appetite, nausea and vomiting, abdominal tenderness, low-grade fever, fatigue and weakness. Additional signs and symptoms that occur with severe alcoholic hepatitis include fluid accumulation in your abdomen. This condition is called ascites. Confusion and behavioral changes due to buildup of toxins that are normally break down and eliminated by the liver. And kidney and liver failure also occurs. Coming to diagnosis, how we are going to diagnose this alcoholic hepatitis? Firstly, we'll do liver function test, then blood test, ultrasound, CT, MRI scan. If all these tests don't provide clear-cut diagnosis, then we'll go for liver biopsy. By this, we can prove histologically proven alcoholic hepatitis: serum bilirubin levels greater than 2.5 mg per dl, serum albumin levels less than 2.5 gram per dl, prothrombin level increases more by 5 seconds. Coming to soap. Soap is a pharmaceutical care plan. Now I am going to discuss a alcoholic hepatitis case in this soap format. S in soap means subject to evidence. This is a subject to evidence of a patient that the person is suffering from yellowish discoloration of urine and eye since 20 days, and he's having low grade fever that is on and off, not associated with chills and rigor, since 15 days. Urinary incontinence, in lack of control on bladder since 4 days. Patient asymptomatic 2 days back, and then he developed these symptoms. Objective evidence. When we perform all the diagnostic tests, these are the objective findings in the patient case report. That is, serum urea levels and creatinine levels elevated. Electrolytes like sodium, potassium and chloride levels got elevated. Liver enzymes got elevated. PCV, packed cell volume, got decreased. Rapid urease test showed positive. C-reactive protein, the test will do to check the infection status, also shown positive. Endoscopic report suggested that the patient has gastric and duodenal ulcer. Assessment. Based on the subjective and objective evidence, the diagnosis is done as the patient is suffering from alcoholic hepatitis with UTI. Goals of therapy. In this case, the goals of therapy include to provide symptomatic relief, to prevent further GI complications like bleeding and perforation as the person is having ulcer, to maintain electrolyte balance, to treat infection, to improve the liver and kidney function, overall to improve the patient quality of life. This is the patient specific treatment that has particularly given in a particular hospital, that the patient is given with injection thiamine, vitamin is a vitamin K. Thiamine is a vitamin B1, vitamin K, Pantop injection, that is pantoprazole, ceftriaxone antibiotic, Newsum, N-adenosine L-methionine, it's a nutraceutical agent. Maxiliv, it contains glutathione. Udiliv, ursodeol, Librium, chlordiazepoxide. Citralca is a urinary alkalizer. These are the medications with doses and the route of administration frequency the patient is treated. In this case, the monitoring parameters are we have to monitor vitals, liver, enzymes and serum. Coming to patient counseling, patient should be counseled about the disease, about the medication and about lifestyle modification. Coming to about disease, as alcoholic liver diseases occurs due to excessive consumption of alcohol, it progresses to three conditions like alcoholic fatty liver, alcoholic hepatitis and cirrhosis. As I said before, 10 to 35% of heavy drinkers develop alcoholic hepatitis. There is nothing but the inflammation of hepatocytes. Risk factors include the how much quantity of alcohol they are consuming, their pattern of drinking, gender, concomitant hepatitis infection, genetic factors, iron overload, diet. All these are the risk factors associated with the alcoholic hepatitis. Malnutrition, especially particularly vitamin A and E deficiency, can worsen the alcohol-induced liver damage. About medication, Newsum 400 tablet is used to treat liver disease associated with reduced bile formation. Maxili 500 is used as supplement for people with alcoholic liver disease to prevent the liver from further damage. Udiliv 300 is used to dissolve gallstones and prevent its formation. Sompress 40 is taken to prevent acidity. Librium is given to prevent anxiety and withdrawal symptoms. Taxim O is given to treat bacterial infection and Citralca is used as a urinary alkalizer. This is the discharge medication. The treatment given in the hospital, same those medications are only prescribed in discharge medication by changing the dosage form. While treating, they are given as IV. While discharge medications, they are prescribed in tablets, oral dosage forms. About lifestyle modification, what are the lifestyle modifications for a alcoholic liver disease patient? Means they have to eat a balanced diet and avoid too much processed or junk foods. They should detoxify their body by drinking lot of fluids and reduce the salt and fat intake, and have plenty of fruits and vegetables in the diet. Stay away from the alcohol. Limit the quit smoking as it worsens the liver condition. Avoid stress by doing yoga and a meditation. Do regular exercise as it lowers the fat accumulation in the liver. Avoid toxins and use of illicit drugs. Maintain a healthy weight. Adequate sleep of 8 hours is always essential for a person. Thank you.